They actually mentioned a prodrome, but just dismissed it outright without even citing any evidence, which I thought was quite interesting. So based on opinion, it didn't exist for MS. So I found that intriguing. Why would MS not have a prodrome when you've got Parkinson's disease, other immune-mediated diseases, rheumatoid arthritis, and so on and so forth, clearly having some kind of prodromal phase? 2 years before, you could see there was a hot hit in terms of their cognitive performance, 2 years before MS symptom onset. And then in the small group who had primary progressive MS, there was suggestion that there was hit on their cognition 10 to 20 years before MS symptom onset. If you're thinking about primary prevention of MS itself, if you want to know what causes multiple sclerosis, I think you've got to be really mindful for researchers out there who are searching for the cause of MS, risk factors for MS, to factor in this potential prodromal phase. Hi, my name's Helen Tremlett. I'm a professor in neurology at the University of British Columbia in Vancouver, Canada.
And I'm Brett Drummond. You're listening to the ECTRIMS podcast, the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. If you talk to a person living with MS about their journey, one of the first things that they will tell you is that they knew something was wrong long before they received their diagnosis. While this anecdotal evidence has been commonly discussed, it is only relatively recently that the research world has started to investigate this concept. Through this work, the idea of an MS prodrome has been studied, which has generated a large amount of interest regarding the potential implications for earlier diagnosis and treatment initiation. My guest in this episode, Helen, has been instrumental in leading the charge for recognition for the existence of an MS prodrome, having published extensively on this topic. Helen, thanks for joining me.
Thank you. Thanks for your interest in this topic.
So I guess to start with, for some people listening, the idea of a prodrome in general might be something a little bit foreign. So can you just explain to us what a prodrome is?
It's an early symptom or early set of symptoms that heralds the onset of a disease. So in context of multiple sclerosis, we're talking about the period leading up to MS symptom onset or classical recognition of MS as we understand it today.
Yeah. And so I guess in the introduction, I mentioned that talking to people living with MS, they have an understanding of this concept and they will talk about it quite commonly. But what evidence from a research perspective was there that there was an MS prodrome that might exist? What sort of initiated an interest in starting to look for this?
So before we looked at healthcare use to try and get an understanding of this prodromal phase, you're right, most of the studies were kind of anecdotal that were published, really interesting and intriguing, but based on fairly small groups of individuals and asking people with MS to recall previous symptoms that they experienced before onset of MS. So there were a handful of studies kind of showing that major depressive disorders, for example, were more common before MS symptom onset. But again, this was like 30 individuals with MS and they were asked to recall. So what we try to go in and do is find an objective way of measuring this period before MS onset and MS symptom onset. And we decided to use our healthcare data because you don't need to consent patients. We've got a universal healthcare system in Canada. And so we went in and looked at all our hospitalizations, physician visits, prescriptions filled in the 5 years leading up to MS onset or a first demyelinating event.
Yeah. I know one of the things that you've said before around this is early on there was quite a bit of skepticism about the existence of an MS prodrome. Can you just share what it was like at the very beginning of this journey of starting to look into this?
Yeah, no, absolutely. I think I was really interested going to a lot of meetings and I suddenly realized that no one was really talking about a prodromal phase. And when you saw that classical timeline shown of multiple sclerosis, it just jumped straight in from risk factors for MS. Sometimes there was talk of a preclinical phase and then boom, onset of MS and diagnosis. Whereas if you go and listen to other presentations, say from Parkinson's disease, they've already got this fairly well-defined prodromal phase. And I found that quite intriguing. I actually went to the library, pulled out McAlpine's Multiple Sclerosis, which was lead medical textbook in of its time. And I went back and found one that was in print through until 2000. And I was interested, they actually mentioned a prodrome, but just dismissed it outright without even citing any evidence, which I thought was quite interesting. So based on opinion, it didn't exist for MS. So I found that intriguing. Why would MS not have a prodrome when you've got Parkinson's disease, other immune-mediated diseases, rheumatoid arthritis, and so on and so forth, clearly having some kind of prodromal phase?
Fast forward to where we are now, I think the evidence is suggesting that there very much is. But so can you talk through what you have found in this space? Because I think it's quite extensive and it's wide-ranging in terms of the things that your studies have and studies of others have really elucidated in this space.
So, like I said, we've specifically focused on our healthcare data. So our first set of studies have really been focusing on the 5 years before either a first stimulating event using our health administrative data or MS symptom onset for those individuals who'd visited an MS clinic, and we had that date for. And so we started off looking at literally just all hospitalizations, all physician visits, all prescriptions filled, not thinking about the reason, but just getting a sense of healthcare patterns in that healthcare use. And we were able to show in the 5 years before a first demyelinating event or MS symptom onset, this was a study my team conducted across 4 provinces in Canada, we found that healthcare use was higher in that 5 years before a first demyelinating event or MS symptom onset. And you can really start to see the closer you get to MS onset, particularly in that year or two before, the number of hospitalizations really started to kick up, physician visits and prescriptions filled relative to a matched population without multiple sclerosis. Yeah. So then our next series of papers, of course, were, well, first of all, we were super excited to be able to demonstrate this and actually measure something going on here. And so then it's created a million other questions, and we've now got on this long journey, and we've got now several papers really trying to tease apart what's going on in this prodromal phase. So looking at the reasons why people access the health system, and by reasons I mean what were the physicians diagnosing them with, why were they being hospitalized, what kind of medications were they filling prescriptions for. And so we have several studies now published, but others have published in this space. And I'll just briefly touch on another really cool, interesting piece of work where these individuals did not have to access the health system. So this was based in Norway, and these were men who were entering the Norwegian military service, which was compulsory at the time, and they were all screened, given a screen for cognition. And that study was published in 2016, and they were able to show that there was a measurable hit in cognition for those individuals who went on to develop MS. So they had just over 900 individuals who went on to develop MS with matched controls. So 2 years before, you could see there was a hot hit in terms of their cognitive performance, 2 years before MS symptom onset. And then in the small group who had primary progressive MS, there was suggestion that there was hit on their cognition 10 to 20 years before MS symptom onset. And I thought that was a really nice study by Cortez et al.
I mean, I think that's mind-blowing to think about that some of these things are starting to show up so long before MS and what that potentially opens up. And I think the interesting thing around some of the studies you talked about in your work is the wide range of things that people are. This isn't one or two things, but there's dermatologist visits, there's psychiatric conditions. We can just talk about all of the sort of spectrum of what you're seeing in these individuals.
50% more visits to psychiatrists, 50% more visits to any physician that ended up in a diagnosis of depression or anxiety. We're seeing pain, headache, migraine, fibromyalgia, sleep disturbances, fatigue. They're all more common in the 5 years before MS onset. And whether you define that as a first demyelinating event or MS symptom onset, more visits to dermatologists, more prescriptions filled for drugs to treat gastrointestinal conditions, more irritable bowel syndrome. And so the list goes on. So it is a very long list of potential conditions that we're picking up there in the prodrome. And of course, it's got to be said, these are all common in the general population as well. Mm-hmm. We're just finding them more common in those individuals that went on to develop multiple sclerosis. And to date, none of these conditions are specific to MS. So I think this speaks to how much further we have to go in terms of making use of these prodromal signs and symptoms if we want to benefit directly people with multiple sclerosis. We're definitely seeing shared features with other immune-mediated conditions, so psychiatric conditions in the 5 to 10 years before diagnosis of MS or rheumatoid arthritis or inflammatory bowel disease. They all seem to share this psychiatric element in their prodromal phases. So huge range of conditions, but you're right, I'm not the only group to look at this. Nice studies from, say, the UK, and they've looked at their just visits to the general practitioner, and they found up to 10 years before a first record for MS. They couldn't get MS symptom onset, but they had a first record of MS present there in the GP records, and they found elevations up to 10 years before with similar features that I'm sharing with you there, or they just have a different way slightly of looking at their findings there. So,
I mean, there's so many things that I want to talk to you about in terms of this, and we'll get on to talking about some of the clinical implications of this. One of the things that obviously we're really interested in MS is being able to predict what's coming next. Can we make any sort of prognosis? Probably a difficult question to answer, but is there any evidence yet for suggesting what people, if there's any link between what prodromal symptoms people experience and how that links to then what their prognosis is moving forward after their MS diagnosis in terms of things like disability progression or other factors like that?
We've got emerging work to suggest there is an association. So we had a poster at most recent ECTRIMS in Copenhagen by Dr. Shirkhoff and colleagues, and he was looking at psychiatric morbidity in the 5 years before MS symptom onset, and he is finding a relationship with subsequent disability progression. Okay. So that's just tackling one element, and we would like to explore this definitely further.
Yeah, really interesting. So going to clinical implications, we've sort of touched on this already in terms of the wide spectrum makes it hard to know exactly, are we going to be able to use this to get an earlier identification of people who may go on to develop multiple sclerosis? Because that's obviously a really interesting and important area. We know now that the earlier we can diagnose, the earlier we can get people onto highly effective therapy, the better their long-term outcomes. What are your thoughts at the moment with where things stand in terms of our understanding about the prodrome in terms of being able to do that? Can you see this being able to identify people at an earlier stage?
I hope so. But I'll answer that question first in terms of thinking about what can we do about this concept of a prodrome right now. Yeah. So right now, if you're thinking about primary prevention of MS itself, if you want to know what causes multiple sclerosis, I think you've got to be really mindful for researchers out there who are searching for the cause of MS, risk factors for MS, to factor in this potential prodromal phase, because you really don't want to confuse a feature of the prodromal phase, someone who already has MS, but just hasn't presented yet with the classical manifestations of MS that we understand today as being MS symptom onset. You don't want to confuse that with a risk factor or a trigger of MS. And it's nice to see, I think, that studies now that are being published are really factoring this in. So there was a nice EBV paper in Science in 2022, and they could show that EBV exposure occurred before the potential prodromal phase. And I thought that was a very nice design. But then, of course, the second question is, okay, so can we use this information to identify people with MS earlier? Currently, no. But it definitely suggests that there is a window of opportunity where we could do this. Of course, we have a problem with lack of specificity. And I think that where we're going to have to go in the future is we're going to have to find a combination of these signs and symptoms, and we're going to have to combine that with other risk factors and biomarkers to help identify people in that prodromal phase earlier and identify people earlier than we can do at the moment. So just again, drawing on the field of Parkinson's disease, they now have this prodromal criteria for research purposes. And so I would love to be able to sort of mirror what they've done. And you may combine with these prodromal signs and symptoms with, say, age and sex, risk factors for MS, family history, maybe neurofilament light levels if you have them. Again, they're not specific to MS, but it just adds up perhaps into, or we have a polygenic risk score for multiple sclerosis. And if you can combine all these features together, we could reach a certain level of certainty where we could be sure someone was in the, or 80% sure they're in the prodromal phase of MS. Then you may be in a position to offer ethical enrollment in a clinical trial of a novel neuroprotective randomized controlled trial. So that would be similar to what's going on in RIS, but one would hope this could reach a broader population. RIS is very rare. You have to have an MRI to get it picked up, but it's a really great proof of principle that RIS have been able to show that disease-modifying drug use early can be beneficial. So I would like a similar thing feasible in hopefully in prodromal MS, but we'd have to think very careful what that intervention is. And I think it would require a lot of conversations with people who this would affect. You know, would they be willing to take this kind of drug if they were 80% certain that they were in the prodromal phase of MS? Would they stick on that kind of medication? Would it be something they'd be interested in? So some way to go, but I am excited.
Yeah. Do you see a future where we might have, hypothetically, a computer where we can input all of this information around, you know, prodromal symptoms that a person's experiencing, there's other risk factors, to spit out a probability score, and a sort of predictive algorithm where we spit out a probability score of developing MS in the future? And is there already work being done on that, I guess, using data that's already there where we know the end goal?
I think many teams are now working on this. Yeah. So yes, I think there's a lot of opportunity for machine learning and so on to really bring these features together. I think you really want transparency though. You don't want to create sort of a black box approach where you don't really understand what's going in to predict this probability. But yes, absolutely. I think there's opportunity there.
Okay. I mean, it's a really fascinating area. We've seemed to have come a really long way since I remember you first talking about this at anectrums a few years ago. For you, what's the most exciting next steps in this? What are the next questions that you want to see answers to? What are you hoping that sort of within the next 12 to 24 months we see sort of come to fruition in the area of the MS Prodrome?
So there are many things, and I think you touched on that at the start of the conversation here. We want to know whether these prodromal features are associated with subsequent, say, disability progression. So my team are actively working on that. How can we combine these signs and symptoms together to perhaps more accurately predict someone in that prodromal phase? How can we combine it with risk factors and other biomarkers? What would we need to combine to be able to identify people MS with greater confidence than we can with these individual non-specific signs and symptoms at the moment? And of course, we're now trying to look back further than just this 5 years. So we're going up to as many years as we possibly can before MS symptom onset. And we want to see when each of these features start to kick in and start to escalate, which ones come out first. I think that would be really interesting as well, which my team are working on. But there are many groups now as well coming at this from all different angles. And I think that's really exciting. Yeah.
Look, it's a really interesting area, lots of really fascinating things coming out of it. Thank you so much for sharing your insights with us today. It's been excellent.
Thanks as always, Brett, and I love your podcasts.
Thank you. And thanks everyone for listening. Once again, I'm Brett Drummond, host of this podcast episode and co-founder of MSTranslate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community. The ECTRIMS podcast is produced and hosted in collaboration with two key partners, MSTranslate and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The 2024-25 ECTRIMS podcast series is supported by educational grants from Alexian AstraZeneca Rare Disease and Novartis. Educational grant providers have no input in the podcast content. You can read more about the topic of this latest podcast episode and more on the ECTRIMS website, ectrims.eu. Do subscribe to the Ectrums podcast on your favourite podcast channels and follow Ectrums on X, formerly Twitter, LinkedIn, Facebook and YouTube.